Hello, um, good afternoon. My name is Dr. Asit Paul. I am a medical oncologist at VCU Medical Center and Massey Cancer Center. I also run the clinical trials in prostate cancer in Massey Cancer Center. So September is the Prostate Cancer Awareness Month. As you know, prostate cancer is the most commonly diagnosed invasive cancer in American men. This is also second most common cause of cancer-related death in American men. Approximately 1 in 8 American men will be diagnosed with prostate cancer in their lifetime. So today we have Mr. Richard Landis with us. Mr. Landis was diagnosed with prostate cancer stage 4 in 2016. He's currently undergoing treatment at VCU Massey Cancer Center. He's been kind enough today to make some time and share his experience through the prostate cancer journey. So, Mr. Landis, welcome.
Thank you for having me, Dr. Paul.
I really appreciate you coming forward and making some time to share your experience with our patient audience and people who is out there who wants to know about prostate cancer. Well, let's start. So tell me about yourself.
Well, like you said, I was diagnosed at the age of 59. I'm now 63, and I'm a father. I'm a grandfather. I'm a husband. I live a relatively quiet life out here in Hanover County, you know, I retired 3.5 years ago. Somewhat prompted by my diagnosis. You know, I'm just living a quiet and I feel like a relatively happy life right now. And like I said, it's been 4 years since my diagnosis. And I can't tell you how much I've appreciated the care that I've received from Massey. I'm in such a better place than I ever imagined I would be, given the start of this whole journey. You know, my life right now, you might be able to see behind me is a bunch of pictures of my family. That's my focus. I've got a 4-year-old grandson who's the love of my life. And that's what I'm focusing on. My wife's getting ready to retire here in a couple of months, and I'm very much looking forward to spending our retired years together and traveling around the U.S. and enjoying what all is out there to offer us.
That's great.
Yes, yes.
And that's great. And I'm seeing the picture in the wall, and you are a loving father, loving family man. And that's great that you are enjoying your time. I think one of the message we like to give our patients who are diagnosed with prostate cancer or any other cancer, that diagnosis of cancer is not the end of the world, and we can able to help, and we can able to manage cancer based on what is happening in the field. There is excitement, there are a lot of advances happening, and in Massey Cancer Center, we are incorporating those new data, new information in the management of patient. So let's talk about how was your health before you were diagnosed with prostate cancer?
I always thought I was in great health. I did have, you know, a somewhat of elevated blood pressure and elevated cholesterol, but it was all being controlled very well with what I thought was minimal amount of medication. I exercised religiously 6 days a week. I was at the gym. Very rarely, if ever, got sick. I felt like I was a healthy guy. Uh, I got annual checkups with my general practitioner. He, you know, outside of the elevated blood pressure, which again was controlled, and the cholesterol, like most Americans, I fit right in there. My weight was good, and all my blood markers were excellent. My GP was always envious of how healthy I appeared to be. But one thing that I always got as part of my annual examination was a PSA score. And it had remained stable for years and years. It didn't vary much at all. And I believe it was 2015 or 2014, it had doubled. It doubled from, I think it was like a 0.9-ish to like 1.5. He pointed that out to me, but because of, and this was, I knew nothing about prostate cancer at that point. He said a relatively low PSA, still within the normal range. And then the following year, it had doubled again to 3.0. And that's when he recommended me seeing a prostate specialist. And that's, you know, my health, you know, I always thought was good. I always had a lot of energy. I was very active. I've got a lot of land and animals and things to take care of. And I always thought that I was in great shape. So this diagnosis was, came totally out of nowhere from my perspective, because I actually, unfortunately, almost prided myself on my health.
So this, your experience is, in fact, the experience of many people, many patients. They're healthy all their life, and they suddenly get a diagnosis of a devastating disease. And cancer itself is an very serious condition and can be significant impact on your health, on your life, on your mental capacities. So it's a significant stress, but I can tell from my experience, many people, they have a healthy life, and that suddenly the cancer just took by surprise, that they get the surprise. I think your story probably will resonate with many of our patients who are out there, who are diagnosed with very similar way. But it also really highlight the importance of going to doctors and get regular checkup. Yeah. When we are getting older, and prostate cancer is one of the disease which generally happens to elderly population, and it can remain asymptomatic for a long time. People may not have any symptom whatsoever until it is very late. And for you, I know that when I met you first time, we saw that your disease has spread outside the prostate. So it's a relatively advanced disease in the beginning, but you did not have any symptoms.
Right.
So I'd like to ask you, how did you take the diagnosis when you know that you have the prostate cancer? How did you really feel? How did you?
Well, I think a little bit about my well, start off, I did not handle it well, not well at all, with very little, if any, dignity. I was, you know, my imagination just ran wild. You know, I wasn't expecting it. all I could think of was, cancer equals death. And I wasn't ready and didn't want to die. Nobody does. Nobody does. But it was, as you said, the symptoms, I really didn't have any symptoms, but psychologically it really took a toll. But at least I had enough awareness, I think at that point, that I really needed to seek out mental health professionals. You've got your family, you've got your friends, but I needed to talk to somebody who wasn't that close to me. Somebody who could give me real information, real advice, without being emotionally attached to me. So I looked at MCV. I talked with a counselor at MCV, one of your senior psychiatrists. I was trying to look up his name, but he was such a help to me, just such a help. I also searched out the leadership at my church. My faith's very important to me, and friends and family. But it was, my mind just kept spinning out of control. I was so anxious, and just very uncomfortable with the diagnosis. And really there was probably a 2-month period where I really didn't know much. I knew I had cancer. I knew I had prostate cancer, but I didn't know how bad. I didn't know. And it was really those 2 months that were the worst for me. But again, and I also searched into around Richmond area. There's I know of 2 organizations that provide support groups where you can talk to other people in the same situation. I personally decided not to go that route. I wanted so bad to be normal. I didn't at that point want to wallow in my pain. I just wanted to get back to normal. I just wanted peace. And also with talking with people, there were also drugs. Some drugs that I took that just took the edge off the anxiety. It really kept me from being more manic. The anxiety didn't go away completely, but it just was enough to keep, so I could go to work, I could interact with my family, and I could actually provide some self-care and not really head down that dark hole. So that was, for me, it was the mental thing. And, as I went through the series, once I understood more my diagnosis, once I saw the positive results of the treatment, my mental health got much, much better.
So this is a very, very important experience you just shared with us. I think, as I just mentioned, that cancer is just by the name, it is a stress to anybody. So how to handle this stress may depend on the person. Some people can manage by themselves, but we also encourage all the time that you feel like that you are overwhelmed by the diagnosis. And this is very, very natural to become overwhelmed. Diagnosis itself, knowing about the prognosis of the disease, sometimes the treatment. Many times treatment are very complex, they are not straightforward. Sometimes the treatment has its side effect, toxicity. So it is a very common experience that you undergo. Any person who is diagnosed with prostate cancer undergoes a lot of stress. So one thing we like to encourage anybody who is newly diagnosed to talk to us about how to handle the stress. It's not keeping within yourself. It sometimes does not help. And we have in Massey Cancer Center, we have the integrative health department. We also have supportive care clinic. So our supportive care clinic, this is within our division in the cancer center, but it is a separate clinic which has their own psychologist, own supportive care physician. There are social worker. So they are there to assess you and help you and show you the resources which are available out there for you to handle the stress. It's not only the stress of the diagnosis, sometimes it's financial stress. So cancer is considered a serious diagnosis, and insurance support and insurance issues can be very complicated for many patients. Right. So we have the social worker here, and we routinely help them to navigate through the insurance system. We reach out to people who are expert in this field. We also, if you don't have a proper insurance to get treated, we reach out to the foundation, different kinds of organizations who are supportive to help cancer patient undergoing treatment, and there are multiple resources available, and we can talk to you about that. So I think your experience and the way you handle it, that's perfect. You just don't keep within you. You try to reach out to professional people, and you not necessarily always need a medication to help. Sometimes just talking and sharing information, getting some feedback, input, that helps. And I know most of the people, when they're diagnosed with cancer, once they start the treatment and they started getting some response, they settle down like you. Right. Then actually they realize that it's not as bad as it considered to be the general conception out there. Right. Everybody is different. Everybody might have a different experience, but we strongly encourage you to reach out to us, your oncologist, your physician, social worker. We have psychologists in the supportive care clinic. So integrative health can help you go through the physical stress. So when you get cancer treatment, you might need diet, physical exercise. Our integrative health, the department, they also offer periodic yoga clinic, for example, which help you to focus, which help you go through the physical distress, and many times they also help with the side effect of the treatment. Mm-hmm. So there are a lot of resources available in addition to our website. When you come to the clinic, we like you to talk to us about that, and we can help you navigate through this. All right, so the next question I have, so you have the diagnosis, and then you came to see us, I know. So what did you do next? Just tell me what your journey at the beginning of the cancer treatment. Okay. What did you do next?
I think one thing I just want to, for anybody who's listening to this, I think one of the biggest mistakes that I made was that I went to the internet before I fully understood my diagnosis, before I really talked with professionals about it. And that was just, for me, it was just like pouring fuel on the fire. You know, as wild as my imagination could run, there was something on the internet to support that. And I would really encourage people. I know everybody wants to know what they have and all its permutations, but that was the worst single thing that I did for my mental health. So I would say, you know, lean on the medical professionals to get your answers, to get your diagnosis, to get your prognosis. I think that's just really important. And that was my personal experience. You know, I think, as we've already talked about, I don't think going this alone with like a stiff upper lip and keeping it all in and trying to be strong. I think you need to talk to people and experience and just tell them how you honestly feel. That's the only way that you get real help, is to really be honest and not necessarily worried about how you're coming across. Because I was a mess. You know, you saw me. It was. I mean, I look back on those days, and I actually was hoping that. I was thinking about it, that if we would have had this conversation closer to the diagnosis time, I could probably be more accurate on exactly how I felt, because as the days get further away from it, the more it becomes, you know, just a bad memory. So, you know, that's, you know, don't go it alone. Seek out mental health professionals. You know, if you're part of a faith, you know, reach out to your faith people for support and encouragement, and just trust the medical professionals. I referred to the psychiatrist at MCV, which unfortunately I can't remember his name, but he was not a religious man by any stretch of the imagination, but he did say if there was one prescription that he could give to everybody who came into his office, and he was mostly referring to cancer patients, he said it was faith. He said he doesn't have it, but everyone that he saw that went through this journey, the people of faith, and whatever faith, fared the best. So anyway, that he just threw that out there, and that really resonated with me.
This is a great point. It's a great point which you are emphasizing, that share with the medical professional. So one thing I just like to add, we are in the social media era now. Lots of resources in the internet out there, a lot of information out there. Actually, more than what we need now. There's so much information out there regarding cancer, but it's important to identify which are the authentic information out there. Mm-hmm. I can write my experience, and I think I always tell my patient that everybody is an individual patient. Your experience, your disease codes, your diagnosis may not match with another person. So other person's experience may not be applicable to you. It is actually, sometimes we box the people, like all stage 4 prostate cancer patients are same. Mm-hmm. And that's not true. There is a big heterogeneity, there's a big difference among patients, and how you treat people, how you manage their cancer, how they experience the side effects, they're also different. Mm-hmm. So we started giving in Massey Cancer Center some authentic link where you can go and get verifiable, authentic information. Mm-hmm. So some example are like American Cancer Society, National Cancer Society, National Cancer Institute, mm-hmm. or there are a lot of patient advocacy groups, which are information are given by the experts, shared by the patient. So I would strongly recommend that just don't believe or trust whatever is out there, because there are also a lot of misinformation out there, which sometimes complicate your journey through the cancer.
And a lot of it is really old. You know, 10 years old, and from what I can tell, so much has progressed in the last 10 years that it's almost irrelevant. Yeah.
That's true. We have a lot of, particularly last 5 years, there is a big jump in terms of how we treat cancer people, how the outcome are. Many cancers are now, like even with stage 4 disease, you can be cured.
Mm-hmm.
We are not at that stage that we can cure everybody, but a significant amount of people can prolong their life, can have a good quality of life, even with stage 4 cancer. So I just want to give this recommendation that anybody goes to the internet, make sure who is providing that information. Is it verifiable? Is it authentic? Many of the misinformation, it may be difficult for many people to find it whether it is true or not true. But in Massey Cancer Center website, there are links out there, which are the, and if you go to American Cancer Society or National Cancer Institute website, you'll find the link, authentic link for that particular. That's I would strongly recommend. So, Mr. Landis, so I know, and you already mentioned that sharing information, talking to people, talking to professional help. One of the very important part, one of the important partner through your cancer journey is your family. And your family support, your care provider, or your wife, your other family members, your children, they are your partner. They are the partner of people. So I just want to know from you, how does your cancer diagnosis impact your family? And do you have any particular advice to the family and care provider of people, those who are just diagnosed with cancer or prostate cancer?
Yeah. I think you need to tell them. Cancer has been evidence in my family. My father had bladder cancer, and I think from what I understand, that prostate cancer may have a heredity component to it. So, I immediately made sure that my son was aware of that. A couple of cousins, male cousins who were close, and in fact, I called to tell my brother, who's 7 years older for me, only for him to tell me he was just diagnosed with prostate cancer. So I think you need to tell them. You need to tell them, tell the other males in your family what you know, and that they need to stay on top of this. Be especially sensitive to this, because there might be, a heredity component to it. I think when I told my family, somewhat of the same reaction. They didn't want to lose their dad, their husband, their grandpa. But I think what they provided most was just having a normal life, for them to be snarky with me, to challenge me, to not pamper me or feel sorry for me. I just, and that was the most important thing for my family, was to get back to normal, for them, and for them to treat me just like I was before I was diagnosed. That to me was the most important. I don't know if that's something common for everybody. I don't want to, I certainly didn't want to be a burden to them. Although I did cry on their shoulders many times. But
That's great. That's
thank
great.
God we're past that. They don't look at me like, I'm dying. I've got, a terminal disease. They don't look at me that way. They don't treat me that way. And that's the way I want it. That's the way I want it. I know it's kind of cliche to say you don't want to be defined by your disease. You don't. I don't. I don't want to study it. I don't want to talk about it. I mean, I want you to do that. I want you and Gwen to do that for me, and I trust you. I trust you. So anyway.
Right, so you are undergoing treatment for 4 years, and for any prostate cancer patient, hormone treatment is one of the critical part of their treatment regimen, and you're undergoing hormone treatment for almost 4 years now. Mm-hmm. And so tell me your experience with the hormone treatment, its side effect, and how are you managing those?
For me, the only, no, I'll take that back. My energy level is down, but it's certainly manageable. Yeah, I can't go from sun up to sundown anymore physically. I don't know how much that is just getting older, or how much it has to do with the treatment, but it's not debilitating to me. Hot flashes have been the primary experience or side effect that I've had. And I remember we were talking one time and you were saying, well, we have some drugs that can help you with that. And I said, I don't really need that. And you looked at me and you said, that's how you know it's working. That's the good side. And every time I have a hot flash, I don't really worry about how I look. I feel like it's still working. So I've read and talked with some other people who have not had very good experiences with the hormone treatment, but mine has not been bad at all. Not at all.
So I really want to thank you because you are participating in a clinical trial in Massey Cancer Center, and we in the Massey Cancer Center we value the importance of trial so much, because through the clinical trial, patient has the experience, has the opportunity to get new treatment, what is out there. So we have a number of trials for prostate cancer, and we have also trial in any other cancer in Massey Cancer Center. So I really appreciate you participating in our trial and advancing the science in that field. Sometimes trial does not help you directly, but it helps the people who will be diagnosed in the future. That's how the treatment in prostate cancer has evolved and developed. So I just want your experience. How do you feel like going to trial, and what advice you will give the people who are just diagnosed cancer to consider clinical trial as part of their treatment?
Since I've never had cancer before and been involved in a treatment, it just seems like normal. Dr. Parker, interviews me every time I come in for a treatment, and I know it's related to the trial, but and I bring back my empty bottles of medication, and I barely notice that I'm part of a trial.
Right.
And I wanted to think that I got in the trial because I wanted to help future patients. I wanted to think about that about myself, but to be really honest, I was sort of hoping that I would get the latest, greatest treatment, and when I got selected, I got the standard care. I didn't get which turned out great for me. I mean, it's as far as I can tell, it's working fabulously for me. So I wanted to feel more magnanimous about my participation, but it really was pretty selfish.
No, that's really, really important. It helps people, and I cannot thank you enough, because this is how science advances, how treatment advances, how we can offer cutting-edge treatment to patients. So we strongly encourage, if there's a trial available, look for trial and get new treatment if possible.
Yeah.
So how are you doing now? So after 4 years of diagnosis, undergoing active treatment,
well,
how do you feel today?
I would say much better than I ever imagined. I was praying to get a couple more years, but after 4 years, I'm much better. You know, physically, I think I've adapted to the treatment. I understand my limitations and my symptoms, and I accept those, and I am absolutely fine with that. You know, it's more important for me and for my family that I be alive and interacting with them than any sort of side effects. I can perfectly live with that. You know, and I can do everything I did previously. There's nothing that I can't do because of the treatment. And, you know, I don't know what people think about, know people who've gone through other treatments and chemo, and I know how devastating that can be. But the hormone treatment that I'm taking now has not significantly affected my quality of life, and it's nothing. I didn't think it was going to be this way. So I'm doing really well.
As a physician treating Mr. Landis, I just want to tell that we have the last scan, last blood work. Everything showed fantastic, and his disease is very well controlled. His scan looked very stable, actually showed significant improvement compared to when he started the treatment. So every patient with cancer are different. Every cancer is different. We cannot equate experience of prostate cancer with a lung cancer patient, for example. So I think everybody's journey is different, but we want to get some idea, and thank you, Mr. Landis, for sharing this information, that even with a stage 4 diagnosis in prostate cancer patient, it's possible to maintain quality of life, get treated, and disease well controlled. And I'm hoping we can able to continue this status for Dr. Landis, for Mr. Landis for a long time. And with the new...
I just wanted to thank you for taking such good care of me. You and Glenn,
sure.
It's, I couldn't have gotten a better team. And it's for my personality, you guys are the best. So I appreciate it.
This is really teamwork. Myself, I lead the team as a medical oncologist. I am the principal investigator trial, but everybody is an important part of the team. So Gwen Parker, what Mr. Landis was mentioning, she's my nurse practitioner. She takes care of patients. She does the follow-up. And so she's very important clinical part of my team. We have multiple research people who are working to make sure you are treated according to the book, according to the protocol, according to the regimen. You probably don't meet many of them in the clinic, but they're working behind the screen. We have nurses. I have my nurses. We have the nurses in the infusion center, our treatment center, with the nurses in the clinic. We have the social worker that help us navigate many, many difficult social and social issues, for example. And this is always a teamwork. And if the team works well, we do a good job. So I personally don't take any credit on myself. I think it works because everybody works well. And we hope to continue that in Massey Cancer Center. We really like to serve you and help you through a difficult journey for the prostate cancer. So do you have anything to add, Mr. Landis, at this time?
No. You know, I'm just thankful for where I am and thankful that I got that I made my way to Massey Cancer and specifically to you and your team. So I'm you know, praying for many more years and many more hot flashes.
All right, thank you for coming today. Thank you for your time and sharing your experience. I hope that will help people who are recently diagnosed with cancer, who are undergoing treatment, or looking for clinical trials. And this is also probably will be a very important support to the family members and care provider and everybody who are taking care of their dear one with cancer. In the cancer center and VCU health system, we are here to help you and serve you. This is really a phone call. You can call our clinic, you will call our new patient coordinator, and we'll do our best to serve you. So you have a good day, Mr. Landis, and thank you once again. Thank you very much.
Take care.
Everybody has a good day. Thank you. Bye-bye.